Hi everyone, I am here today to talk to you guys or educate you a little bit about STDs, what they are, what you need in order to get treatment, what type of treatment do you need depending on what you do come back positive for, um, and just things, some sort of prevention. So first and foremost, we have very different STDs, sexually transmitted disease. We have chlamydia, gonorrhea, syphilis, HIV, um, HPV, genital warts, and the list just goes on and on. And just depending on what you do come back positive for, it just depends on the course of treatment by the physician. It depends on how long you have to be abstinent for, and it also depends on whether you're going to have to be retested or not. So first and foremost, of course, the biggest and uh, way to prevent getting STDs is, being abstinent. And of course, everybody human being, they have needs. So if you can't be abstinent, limiting maybe the amount of sexual partners you do have, um, and making sure and actually having a conversation about uh, how many partners they've had. It's uncomfortable, but at least you have knowledge on who you are sleeping with and who you are getting involved with. Um, Secondly, condoms are not 100% preventative. They do prevent about 98% of pregnancy. They do prevent about 98% of, uh, of catching any STD, for just chlamydia, gonorrhea, HIV, and or syphilis. Um, they don't prevent you from herpes. They don't prevent you from genital warts. They don't prevent you from uh, syphilis if it's a skin-to-skin contact, um, because there may be open wounds, open sores that may still come in contact with the other individual's body, which means that now they're probably infected and go back and forth with the skin to skin. As we were talking about the different types of disease, gonorrhea and chlamydia is probably one of the biggest STDs that has boomed out, and it's only because it's fairly more common than most. Um, Depending on female or male, they do have different type of symptoms, which would be vaginal or penile discharge, foul odor, pain, just depending on what the symptoms have. Many patients get different ones. Some patients may have months with it and not even know it. Um, but the treatment for that would be azithromycin, which is given orally, and also Rocephin, which is given injected to the body by administration of a medical healthcare, either physician, nurse, whoever orders. But those are typically the medications that are given for patients who come back with either gonorrhea or chlamydia. Now with syphilis, just more so, um, the treatment is a 3 month, for the most part, a 3 month um, injection of penicillin, and it is given for 3 months. So it's three different doses, different times. Um, with syphilis, it is something that does go dormant. It does not go away, so that has to be something that has to be taken care of. Um, the biggest thing with that is that you may think it is private because we are covered by the HIPAA law. However, when it comes down to um, somebody not knowing, unfortunately, physicians do have the duty of informing public health that you came back positive with any sort of STD, and you if you don't follow up with treatment, if you don't follow up with your sexual partners, you will be getting a phone call from public health. And those phone calls, from what I have heard from many people who have been upset, because I do work in healthcare, are not happy that people know their business. So what it is reported is what they came back positive for, what sort of treatment they have gotten, and if so, they're going to be retested. Once you come back positive with an STD, the physicians do recommend for you to be abstinent from any sexual activity for at least, it just all depends on the physician, 3 to 4 weeks, and then getting retested. If the doctor doesn't request a retest, it's usually based off of symptoms. HPV, human papilloma virus, is something that children now between the ages of 9 to 26, moving on to adulthood, they have a vaccine that has been offered to most as prevention, and that would prevent, creation of cervical cancer cells, genital warts. It does help with female and male. So that's another option that we may have. Like I said, the biggest thing is just being abstinent if it does come to that. But like I said, that's not the solution, but it is something that can obviously alleviate the number and growth of numbers that STD has boomed in the last couple of years. Yeah, that's pretty much it. Thank you guys so much.